Hey there. If you're using Zepbound, you might be wondering where exactly you should inject it. Let's talk about what the FDA label actually says. Here's the important part. All three FDA-approved injection sites work equally well. We're talking about your abdomen, your thigh, and your upper arm. The FDA label is clear on this. There are no clinically meaningful differences in how the medication gets absorbed between these sites when you use proper technique. So you don't need to stress about picking the perfect spot. What really matters is using the right technique and rotating where you inject each week. Now, before we go any further, this video is general education only. It's not medical advice. Always follow your prescriber's instructions and the Zepbound instructions for use that comes with your medication. That's your official guide for how to inject safely. Let's break down each option. The abdomen is probably the most popular choice. You'll inject at least 2 inches away from your belly button. This area usually has enough subcutaneous fat, which is that layer of tissue right under your skin. Plus, it's easy to reach on your own. The thigh is another solid option. You'll inject into the front or outer portion of your thigh. A lot of people like this spot because you can sit down while you're doing it, which can feel more comfortable. Then there's the upper arm, specifically the back or outer area. This one can be trickier because it's harder to reach. You might need someone to help you with this spot. Here's what's really important. Zepbound needs to go into that subcutaneous tissue, the fatty layer beneath your skin, not into the muscle, not into a vein, just that fatty layer. There are some places you should definitely avoid. Don't inject into any area that's tender, bruised, red, scaly, or hard. Stay away from scars and stretch marks too. These spots can interfere with how the medication gets delivered into your system. Now, here's something that really matters for long-term success. You need to rotate your injection sites. This doesn't mean you have to switch between your abdomen, thigh, and arm every week, though you can if you want. What it means is that you should move to a different spot within the same area each time. So if you're using your abdomen, don't inject in the exact same spot week after week. Move around that area. This helps keep your subcutaneous tissue healthy and reduces the chance of developing reactions at the injection site. Some people develop a routine. Maybe they inject on the right side one week, then the left side the next, or they might move in a pattern around their abdomen. Find what works for you and stick with it. For the specific steps on how to use your Zepbound auto-injector, like timing and technique, follow the instructions for use that came with your medication. That's your official guide, and it has all the details you need for safe administration. Here's what you should know about the device itself. Zepbound comes as a single-dose pen. That means you use it once and then dispose of it in an FDA-cleared sharps container. Don't try to reuse the pen, and make sure you're disposing of it properly according to your local regulations. If you're having trouble with injection site reactions, like redness or irritation, that's something to bring up with your healthcare provider or pharmacist. They might suggest adjusting your technique or trying a different injection site. Same goes if you notice any unusual symptoms after injecting. Your healthcare team is there to help you troubleshoot these issues and make sure you're getting the most out of your treatment. Remember, everyone's body is a little different. What works perfectly for someone else might not be your ideal approach. That's why it's so important to have ongoing conversations with your healthcare provider about how things are going. They can watch your technique, answer your specific questions, and make sure you're following the proper steps from your instructions for use. So here's what to remember. All three FDA-approved sites work equally well when you use proper technique. Rotate your injection sites to keep your tissue healthy, and always follow the instructions for use that came with your medication. The goal is consistent, safe administration week after week. When you nail down a good routine with guidance from your healthcare provider, it becomes second nature. What questions do you have about Zepbound injection sites? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more health information. Thanks for watching.